So in most cases, the definitive test to diagnose pulmonary fibrosis is what we call a high-resolution CT scan, which is a CT scan of the chest. You go through the imaging, it's like a donut, and you go through that, and you have what we call a high-resolution scan, which shows the lung in a lot of fine detail. This is almost always organised by a hospital specialist. So it may be done for another reason, and the lung fibrosis is picked up incidentally, or it may be done because you've been referred by your GP because you have a cough and/or shortness of breath. The whole process from referral to the GP, if that's the route that you took, to the hospital specialist takes about 6 weeks from first referral, and then the CT scan will be done within 6 weeks after that. So I would say from first seeing the GP to getting the diagnosis may take up to 12 weeks. So when we think about treatment, I always think about non-drug treatments and drug or medication treatment. And in the non-drug treatment, we include pulmonary rehabilitation. So these are exercise classes which encourage you to do more exercise so that your muscles become more efficient and they need less oxygen. Also, within the non-medication group, we include oxygen, which is itself really a medication, but that can be prescribed either at rest if you have very severe lung damage and you need oxygen all the time, or just overnight or when you exercise. So these will all help you with the symptoms, but they won't actually reverse the pulmonary fibrosis. For drugs or medications for pulmonary fibrosis, we have 2 drugs that won't reduce the fibrosis, but will slow it down so it doesn't get worse so quickly. And these drugs are Nintedanib, or Ofev, and Pirfenidone, or Esbriet. They work in slightly different ways, but they have remarkably similar impact. They reduce the way in which the lungs fibrose by about 50%. And both of them do have side effects, unfortunately. So Pirfenidone or Esbriet makes your skin very sensitive to sunlight, so we advise that you wear a hat out in the summer and you use factor 50 sun cream pretty much all year round if you expose yourself to the sun. The Nintedanib or the Ofev has gastrointestinal side effects, so it can cause nausea, diarrhea, and weight loss. However, we have a lot of experience now with managing the side effects of these drugs, so we can help you by reducing the dose or taking drug holidays or using other medication to help with side effects or modifying your diet appropriately. So in most patients, we'll say start with a low dose of the drug and see how you get on before you decide not to take it because you're worried about the side effects, as some people don't have a problem at all. The other drugs we use are in the patients who have inflammatory disease that's causing lung fibrosis, so those patients with an underlying autoimmune rheumatic disease. And the drugs that we use there will be the drugs that we use to treat their underlying disease. So for example, with rheumatoid arthritis, these medications will include prednisolone or steroids, and also drugs such as rituximab or anti-B cell therapies, which are becoming standard use in rheumatoid arthritis and also appear to reverse some of the lung scarring that we see in these diseases. In very, very selected cases, we can refer patients with severe end-stage pulmonary fibrosis for lung transplantation, but this is really only suitable for a handful of people who are at the younger end of the spectrum, so patients in their 50s and early 60s. And what I always say to these patients is a lung transplant is not like changing your batteries. You won't suddenly feel completely new. You're exchanging one chronic lung disease for another. So you will remain on medication all your life and on hospital follow-up all your life. But in most cases, the advantages of lung transplant are far greater than the disadvantages in those patients that we put forward for that very specific treatment. This is a question that all our patients want to know. What can they do to help manage their disease? And I would say there's a lot you can do as a patient. So all our patients should be encouraged to exercise. And some of you, that may seem a bit of a tall order, but even just a short walk around the block, or even if you can't do that, just a short walk around the room every day, several times a day, just to keep your muscles strong and remind your lungs how to deliver oxygen to muscles when they start working. For those of you that can manage it, longer walks are fantastic, and any other sport that you enjoy. Even just getting outside with a friend can be very helpful to lift your mood and help with the symptoms. We also suggest a healthy diet and for you to maintain a healthy weight. One of the issues we have is that some of the medications for pulmonary fibrosis either cause you to eat more and increase your weight, such as prednisolone, or you lose your appetite and you reduce your weight, such as Ofev. So maintaining a really healthy body weight is very important. There are other things you can do. Join with groups of friends to do things together. I think company is very important. And singing is something that a lot of our patients have found a lot of improvement from, because it actually helps them regulate their breathing and just breathe a little bit more efficiently. So there are plenty of things you can do that will help. Of course, the key thing I should have mentioned right at the beginning is stop smoking. But many of our patients have long given up smoking by the time they come to us. But if you are still smoking, that's a very big no. There is so much interest, which was started off really during the COVID pandemic, of home monitoring. So what this means is really keeping an eye on patients' symptoms whilst they're at home, so we don't have to keep bringing them into hospital. I would say that if you have stable pulmonary fibrosis, then you can probably be seen every 6 to 12 months by your specialist. However, if you have more progressive disease, and we like to see our patients every 3 months, and sooner if they have very progressive disease. Some of our patients can be managed at home, those who are happy and confident using a pulse oximeter at home and can tell us when their symptoms worsen or their oxygenation of the blood as measured by the pulse oximeter worsens. But at the moment, we don't have very good home monitoring for in other ways. We are trying to develop home spirometric measuring, by which patients blow into a spirometer every day and send their results to us. This is quite onerous for patients and also can be quite challenging. But actually at UCLH, we're really trying to understand a bit more whether we can monitor patients more safely so that we can get very early indicators of when their disease is progressing more quickly than it has done, and so when they need an input from the medical profession. So we're often asked this, and to be honest, as clinicians, we don't really stage pulmonary fibrosis. We recognise that there are patients with changes on the high-resolution CT scan but no symptoms. These patients, strictly speaking, don't have idiopathic pulmonary fibrosis or any sort of pulmonary fibrosis, but they have residual lung abnormalities, which we do need to keep an eye on to make sure they don't progress. But once you actually have a diagnosis of interstitial lung disease or pulmonary fibrosis, we recognise early disease or mild disease, and then moderate disease, and then more severe disease. And usually we define whether you are mild, moderate, or severe depending on your symptoms and your lung function and your imaging. But very, very crudely, if you have a forced vital capacity, which is one of the lung function tests, of above 80%, then we would say you have very mild disease. If you have a lung function forced vital capacity of 50 to 80%, then we would say you have moderate disease. And if your forced vital capacity or FVC is less than 50%, then we would say you have severe disease. And I think that's a reasonably good demarcation of the stages of pulmonary fibrosis. But unlike other diseases, you don't necessarily progress through the stages. You might have mild disease and stay mild, or you might very quickly progress to severe.